maybe knee injuries, hip injuries, and you've been told you need to strengthen your hamstrings, but you don't know where to start. Dr. Madeline here at Forward Spine Center, and today I'm going to go over an exercise called the 90-90, and it's a great way to find your hamstrings. Oftentimes when we are trying to find our hamstrings, we overactivate in our glutes or our quads or our low back without activating our hamstrings, and this is a great way to start. So what I ask you is find a mat, find somewhere against the wall. What we're going to be doing is we're going to lay on the ground, and we're going to place our feet up against a wall. You're going to be pushing against the wall and slightly lifting your hips to help really activate your hamstrings. When we do this, we want to make sure that we don't turn on our quads and we don't activate in our glutes. Yes, we often are told squeeze our glutes because our glutes are often weak, but here we just want to isolate our hamstrings. So what we're going to do here is relax your upper backs, keep your rib cage knitted in. So imagine you have suspenders on and you want to pull that rib cage down and zip up your suspenders. And I want you to think about keeping that in, so keeping your core engaged while you activate your hamstrings. Okay, so what we're going to do here, placing your feet against the wall, 90-90. Start to gently press your feet against the wall, slightly lifting your hips, feeling the activation of your hamstrings. Now lower the hips down. Take a look at your knees. Are your knees level, or is one sitting higher or lower than the other one? You want to make sure that those knees are level. That's going to help to make sure that your pelvis is neutral. Oftentimes we shift towards one side, maybe we hold our babies on one side, or we have a injury on one side. So we really want to make sure that this pelvis is very neutral and even when we're doing this exercise. So take a look at those knees, make sure that they're even. If one of them is sitting higher than the other one, pull that back, push that down into the ground, and make sure that those are level. So again, we're going to explore that hamstring activation again, pressing your feet into the wall, slightly lifting your hips, feeling it in your hamstrings, not your glutes or your quads. Now we're going to lower that down, and you're just going to try one side. So now one-sided lift, so taking one foot off the wall, and then lift, press into the wall, squeezing your hamstring, doing a slight lift of the pelvis, the hips off the ground, and lower down. Where did you feel it? Did you feel it in your glutes? Did you feel it in your quads? I kind of felt it in my quad a little bit. So this is where I would grab a ball or place my feet up on a couch and push my heels into the couch to lift the hips versus pressing against the wall. That's going to help to really make sure that we're just isolating that hamstrings. So then we're going to try it on the other side. Once you get that really strengthening, firing of the hamstrings, single-sided, lifting up and then lowering down and seeing how long you can hold it, maybe holding it for 15-20 seconds, making sure that you're just feeling in the hamstrings, not the lower back, not the glutes. Ribs cage is lowered down, relaxing your upper back. Now we're going to take this to the next progression, and that is where you're going to take one-sided, lift one side off the wall, slightly lift your hips off the ground a little bit, really feeling it in the hamstrings. And then you're going to start to take that leg that's off the wall into external rotation, bringing it out and then bringing it back in. Oh, you feel that fire. You feel that fire in the hamstrings. And then you're going to try it on the other side, lifting the hips, relaxing the upper back, slight lift of the hips, feeling that hamstrings fire. Pelvis is neutral, bringing out and then coming back in. Really just kind of challenging that hamstring in a different way. We're making it we're adding on a different lever. We're adding on another movement of the exercise to challenge that hamstring in it further. So now we're going to do the last progression, a single-sided. We're going to lift those hips off the ground, really squeezing the hamstrings and start to lift the hips off a little bit higher towards the ceiling. And then at the end, you're going to squeeze the glutes. And then lower back down, hover the back, so you're not going to lower the hips all the way down, and then you're going to bring it back up, drive through into the wall, squeezing the hamstrings, and then lower back down, and doing 10 to 15 on each side, really, again, making sure that your pelvis stays neutral, you're not hiking on one side, keeping your upper back, your jaw, your neck really relaxed, rib cage knitted in, pelvis neutral. This is a great progression. So again, you're going to start, I'm going to go over the progressions again, just slightly lifting the pelvis, feeling the hamstrings fire. You can take this into one-sided, single-sided hamstring activation, and then you're going to take it single-sided hamstring activation with external rotation of the hips. And then you'll bring it to single-sided glute bridges, really lifting that hip all the way up, squeezing the glutes at the top. Explore these, incorporate this into your every week hamstring activation exercise. It's a slow progression, and it's a really good way to make sure that you're properly firing your hamstrings without overactivating anything else. And single-sided, oftentimes we're one side dominant, so we really want to make sure that we can fire that single-sided hamstring without overfiring on the other side, without firing our glutes, without firing our quads, really isolating that hamstring. If you have any questions, feel free to reach out. Dr. Madeline here at Forward Spine Center. Thank you for allowing me to be part of your health journey, and have fun.